Welcome back to IRG Physical and Hand Therapy's Health Talk. I'm Ron Chakal with Shannon O'Kelly. Our next guest is Dr. Lisa Walker. She's an occupational therapist and clinic director of IRG Pacific Handworks in Bellevue. And our quarterback here recovered very fast. He had mallet finger.
Yeah, Ron, a mallet finger, the talk of the town. Russell Wilson came back really fast from a mallet finger. Lisa Walker is a certified hand therapist, treats these injuries, and she'll talk about the treatment, the recovery, and return to function from a mallet finger.
Here's Dr. Walker and Shannon O'Kelly.
Lisa Walker, welcome to Health Talk. How are you?
I'm great. Thanks for having me, Shannon.
Well, thanks for coming back. I think in the past you've come on. We've talked about hand injuries. Let's tell our listeners. Let's talk about what Lisa Walker does. Lisa Walker is our clinic director in Bellevue Hand. Lisa, you are a CHT, certified hand therapist. I really don't think the general public, our listeners, really understand the extensive training and the skill that you have when it comes to hand injuries. So before we get into this mallet finger, baseball finger situation, let's talk about your skill set, your training, your background, etc., okay?
Sure. So commonly certified hand therapists would typically have a master's or a doctorate in occupational therapy or physical therapy, but most of us are occupational therapists. And then a CHT is someone who spends a couple years specializing in hand injuries only. We actually have to take a big giant test to get certified, as well as have 3 to 5 years of experience working with hand injuries alone. So it's just a lot more specific care to the fingers, hand, wrist, and elbow.
Yeah, I think you're being a little bit modest here, Lisa, but I understand that. I know you. But, our listeners need to understand that when you talk about training, this is like 3,000 to 4,000 hours of mentorship, direct training with someone that's experienced in hand injuries. As you and I both know, me being a physical therapist, you being an occupational therapist, the hand is extremely complicated. Multiple bones, multiple tendons, multiple muscles. I mean, all you have to do is hit your finger one time and you can appreciate your hand, particularly when it's injured. So you have a lot of training. You deal with post-op, tendon lacerations, cuts, amputations, smashes, trauma. I mean, you deal with all that stuff. I mean, so tell our listeners about again, when you look at a hand injury, and the hand is such a detailed, very specific area, like you sometimes are building splints, you're rehabbing people, you're progressing their rehab based on tendon or tissue healing. It's very complex. Tell us about how you build splints, and maybe you can kind of just talk about that a little bit.
Yeah, what's common, we do see a lot of patients following their surgery, and it's common to see them even a couple days, even the day after a surgery. So looks a little different than PT in that we do a lot of wound care. So we take care of if they have a pin sticking out of their finger or a plate inside the hand, doing a lot of wound care, making sure that there's not an infection, keeping it clean, making that scar heal as best as we can, make it look really good after the scar matures. The other very specific part of being a CHT is making a custom splint. So we all could go to Rite Aid and get a wrist brace, and we all know if we've ever done that brace never fits correctly. So, right. A big part of what we do is we mold a splint to fit exactly the contours of your hand or wrist or elbow, whatever is splinting, and we do that by taking a big piece of plastic that looks flat, and you're like, how is that ever going to mold to my hand? And we put it in high temperature water, and it molds down and gets really drapey, and so it can custom mold just to your hand, and then we strap it on and fits pretty much exactly like a glove.
Lisa, let's get into, you mentioned pins, and we all have heard or read about one of our local football stars here, Russell Wilson, who sustained a mallet finger. Let's talk about a mallet finger from your perspective. Tell us what it is, and then we'll get into the rehab aspect.
So a mallet finger is actually a very common injury that we see, not just from professional football players, but just from everyday folks, from sticking their finger too hard against a drawer, making your bed and pulling your sheet over. Some people have a very unfortunate mallet finger injury just from that very simple daily task. What a mallet is when the tendon that extends your finger, so the tendon that keeps your finger straight, gets ruptured off the end of that bone.
More with Dr. Lisa Walker, occupational therapist and clinic director at IRG Pacific Handworks in Bellevue, coming up next, right here on Como News 1000, FM 97.7.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Welcome back. The conversation continues with Dr. Lisa Walker, occupational therapist and clinic director of IRG Pacific Handworks in Bellevue, and Shannon O'Kelly.
Lisa, thanks again for joining us here on Health Talk. We're talking mallet finger. You described it as, you get your finger bumped at the end, either ramming into something or maybe a ball hits the end of it or you strike it against something. You basically have kind of a hyper movement that pulls this tendon. This tendon is the extensor tendon, most likely. Is that correct?
That's correct.
What are you going to see? I mean, that finger's going to be droopy, so to speak, right? Tell us why it's droopy.
It will look just like you can't extend the tip of your finger. It will just be kind of hanging there. And no matter what you do, you cannot extend it. It just droops. It actually typically doesn't even hurt that much.
And so it doesn't really hurt that much because you rip that tendon. But can you also get a fracture sometimes? Because we know that Russell Wilson, for example, had a diagnosis of a comminuted fracture. He actually had hardware, a pin or a screw put in that finger. So tell us about the fracture.
Yeah, so he got a Boney Mallet. So that means that he hit it hard enough that the tendon ripped a piece of bone off with it. You can either get a soft mallet finger where the tendon just pops off, or you can pull off actually a piece of that bone where the tendon attaches. So that's why they had to put a pin in his finger.
Isn't it cool? Medical people like to use descriptions, bony mallet, soft mallet. So here we have a bony mallet. So they had to replace or kind of reconnect that bone. That bone gets ripped off along with the tendon being ripped off. So is it what you call an avulsion of that bone, kind of a rip of that bone?
Correct. Yeah. And the only way really to fix that is to put a pin in it and then stick a splint on it. And typically that's what the certified hand therapist would do, is to put the splint on right after surgery so it fits that person perfectly.
Let's talk about the rehab process. So if I just have a soft mallet, do I always need surgery, or could I come to someone like yourself? Is that an option for someone?
That's correct. If the x-ray does not show any part of the bone was ripped off or just a tiny part, you'd come to the hand therapist. We would fabricate a custom splint, and you would keep that on for about 6 to 8 weeks with us checking in to make sure it's healing appropriately.
Do you put that finger 100% back in extension, or do you move it gradually in extension? I'd imagine you put it right in extension right away.
Yep, we actually put it in a tiny, tiny bit of hyperextension, and that's just to bring the two pieces of the tendon really close together, so then the cells that help build that tendon back together can do their job a little bit easier. And then we just keep an eye on it.
Yeah, I mean, what about someone who has hardware? Does that change your rehab?
Yeah, if they have hardware in, all we're doing for the first, 6 weeks, if you're not a professional athlete, we're just checking that pin, making sure there's not an infection, and making sure that splint is fitting well. And you really don't start moving it until we take out that pin at 6 weeks.
Now, if there is a pin in there, does the physician surgeon, I would imagine they re-x-ray that before they take the pin out? Do they want to make sure that fracture site is healed?
Correct. They usually do an x-ray at about 4 weeks, and then they'll make sure it's good, and then take it out based on that x-ray. So between 4 and 6 weeks for most people.
Soft mallet, hard mallet, fracture mallet, they in good care, in good hands, so to speak, no pun intended, Lisa. But, I mean, they return to a pretty good play, pretty good return to function, right?
They always end up with good function. You might end up with a fingertip that's not 100% straight, but what we really care about is the function and the pain.
Lisa, wow, great stuff. Thank you for your time, and thank you for what you do for IRG Physical and Hand Therapy. Sure appreciate it.
Thanks so much.
Great information from Dr. Lisa Walker, occupational therapist and clinic director of IRG Pacific Handworks in Bellevue.